Hi, I'm Heloise Peixoto from the MARC Institute. I'm the COO, and I'm here having the pleasure to speaking with Dr. Glaiberman from Epica and about the partnership that we are doing between Epica, the MARC Institute, and GACS. Dr. Glaiberman, please talk a little bit about your background.
Excellent. Thank you for hosting me, Heloise. It's great to be here again. I'm excited about the partnership. I'm an interventional radiologist who's been in practice for over 20 years, who found Epica in 2015 and became involved with the technology because I was so impressed with it, and am currently the Chief Medical Officer.
That's great. And talk to us a little bit about what are the benefits that not only the doctors but the industry can have having access to the Epica machine at our institute.
Absolutely. With the high number of physicians and industry partners who come through your facility every year, it gives us access to those experts and key opinion leaders.
And adding the GACS technology to it, what are the benefits?
The visualization of the anatomy with GACS combined with our CT and fluoroscopic imaging provides a level of anatomy that hasn't been seen before.
And what are the advantages when you talk about 3D printing or research, development of new techniques and products?
It's very important not only for surgical planning but also for education of medical students. The DICOM data that comes directly from our machine can go into 3D printing for that capability.
Great, thank you so much, and thank you for watching us.